Now that we have a background of STIs in Arizona, we will go over health disparities seen with different populations that experience STIs. Let's take a moment to reflect back on some of the data highlighted in the data dashboard overview, along with any data you may have viewed on your own. Why do you think we see higher rates of STIs in certain populations? Why do we see disparities among different populations? STIs are transmitted through intimate contact, so it can be easy to focus on individual behavior. Here are some questions related to individual behavior that we routinely ask during an STI interview. We ask about how many sex partners our clients have, and if they use condoms and how often. We ask about the types of sex clients engage in and whether they get screened often. We ask what drugs they have used and what drugs they are currently using. We occasionally step outside the realm of individual behavior and ask about interpersonal factors. Where do you meet your sex partners? Where do your partners live? How far do you travel to meet your partners? What types of partnerships do you have? Are you monogamous or do you have multiple concurrent partners? We may ask about whether our clients feel comfortable negotiating STI prevention strategies with their partners. We might even ask if they are happy in their relationships. These questions may seem intrusive, but it can give us important information about risks and behavior so we can better serve our clients and ensure we provide the best resources and support that they may need to lead healthier lives. But how often do we think about environmental factors that influence our sexual health? Take a moment to think about that question. If you're feeling stuck, reflect on your own experiences. What experience have you had that have helped to improve your sexual health? What experiences have you had that have negatively impacted your sexual health? Were all of them within your control, or were they a result of larger systemic factors? Where you live is one of many external factors that can have a big impact on your sexual health. Consider the following. What are the rates of STIs in your community? Do you know where to go to receive sexual health services? How far do you have to travel to get there? Do you have reliable transportation to get to that clinic? Do the hours in which services are offered align with your availability? Do you feel welcomed by that clinic when you go in seeking services? Does your provider even ask about your sexual health? Do you feel safe providing truthful responses about your sexual health? Are you worried about being judged or having your confidentiality violated? Does the clinic have the appropriate equipment to offer you comprehensive screening and treatment services? Do you have insurance? If so, do they accept your insurance? Do they offer free services? If not, why? Are they adequately staffed and funded to provide services? Who funds them? Is your sexual health even on your priority list, or do you have other competing needs like food, job, housing, childcare, debt, student loans, car payments, or other bills? Do you even have time to go to the clinic, or are you working 3 jobs to support your family? What does your community tell you about your sexual health? Where did you first learn about your sexual health? How were you taught to care for your sexual health? Is screening perceived as a routine component of healthcare, or do only certain people need STI screening? And on and on and on. There are many environmental factors that influence sexual health. Let's go back to the original question about why we see health disparities. We see health disparities because there are inequities that increase the likelihood of acquiring these infections among certain groups. Access to culturally appropriate care and treatment can allow some people to have more timely treatment for their infections, reducing transmission rates within their community. Other people may not have great options for seeking care. Certain groups of people experience a higher frequency of aggressions, microaggressions, and discrimination from their healthcare providers. These negative healthcare experiences contribute to medical distrust and cause people to delay or avoid seeking screening and treatment. In addition, certain groups of people have historical trauma from unethical healthcare experiences. Even if these aggressions may have been unintended, their impact is very real. As investigators, we strive to live by the platinum rule and treat others the way they want to be treated. Certain groups also face additional stigma, especially related to their sexual health. Providers may unintentionally misgender a client or make assumptions about the gender of their sex partners. Again, while the mistake may have been unintentional, the impact is real. Poverty can impact sexual health in a lot of ways, beyond just the cost of testing, as we discussed in the previous slide. Think about the costs associated with testing. Travel, taking time off work, finding childcare, other competing needs like housing, food, etc., all work to place people at a disadvantage when it comes to STI prevention. Some of our unstably housed clients will stay in unhappy sexual relationships because they rely on their partner or partners for food and shelter. We live in complex social systems that create opportunities for some and disadvantage for others. Variables like race and sexual orientation are surrogate measures for the social impact of belonging to a particular group. And we are not defined by just one variable. Social classifications like gender, race, sex, sexuality, socioeconomic status, zip code, religion, disability, and physical appearance can overlap and intersect in ways that further expose us to privilege or discrimination. Our job is to help clients overcome these structural barriers so that all Arizonans can achieve optimal sexual health and wellness. In this lesson, we have discussed why we may see disparities in STI rates. We covered individual behaviors such as the number of sex partners and how often someone uses condoms. Interpersonal factors were explored, including where someone meets partners and if they feel comfortable negotiating STI prevention strategies. Many environmental factors were covered, including where to go to receive sexual health services and feeling safe and welcome when seeking services. Lastly, we discussed inequities and how there are disparities by race, ethnicity, sexual orientation, and gender identity.